Hi, everyone, and welcome to Policy Unpacked, a podcast by Global Policy Network. In this series, we dive into the policies shaping our world, from healthcare to sustainability to education, and we explore how these critical areas are intersecting to drive meaningful change. Whether you're a policymaker, a practitioner, or just policy curious, we're glad you're here. Let's unpack policy together. My name is Amina Gazelle Sachi. I'm the founder and CEO of Global Policy Network. Today's guest is Azuka Okeke, a dynamic leader driving transformation in Africa's health and pharmaceutical supply chains. Azuka is the CEO of the Africa Resource Center for Excellence in Supply Chain Management, where she leads high impact initiatives to strengthen systems across the continent. Her work bridges public and private sectors, helping governments and organizations rethink how essential medicines and health commodities are delivered. Hi, Azuka. It's lovely to speak to you today. How are you?
I'm fine, thank you. Thank you so much, Amina. It's great to be here, and I'm excited about today's podcast.
Thank you, and we're so excited to have you. And I'd like to start off by delving into a little bit about your journey and vision. So, Azuka, you've built a remarkable career at the intersect of public health, pharmacy, and supply chain transformation. Can you take us back to the beginning? What sparked your journey into this field?
I think starting from my upbringing, my father, coming from an African background, my father pretty much defined what everybody was going to study. He would say, "Oh, you're good in science. You're going to study this." So he told me right from time, "You're going to be a doctor. You're going to study, be a doctor, medical doctor." I didn't really think of it too much, but I think that kind of put something in me, the deep-seated interest in patient level healthcare. He must have seen something that made him feel I would be a good doctor. But I think along the line, I decided I felt clinical medicine was a bit boring. I'm always about exciting things, and I preferred going on the route of pharmacy. But he planted that seed and made me think more around patient level care. And I spent the first 12 years of my career in different areas of pharmacy practice. But I think after 6 years, I delved into public health context. And that was how I started practicing after being a pharmacist. But I began to kind of recognize recurring systemic challenges in the system, that I felt patient level care or clinical care alone could not address. So when you look at things around access to medicines, you look at things around fragmented service delivery, you look at things around the inefficiencies in even managing patients, and faced more like upstream things that you can't tackle when you're dealing with a patient one-on-one. Those were some of the things that made me think, okay, maybe I go and really get my expertise in public health. And that's how I decided, I think way back in 2012. And in thinking of public health, I like the concept of public health in the UK. I did a lot of research, and I found the School of University of Liverpool. They have a very strong public health program that really looked at health outcomes. So I came here, studied, did my master's, then when came back to Nigeria to practice. I then, in that sense, went into public-private partnerships. So that was more looking at it from that angle. How do I bridge, strategic mechanisms to bridge policy from the public angle and the private sector angle? How do we bring in the strength of private sector in infrastructure, because that was a major gap. So service delivery gap. So I was looking at how do we look at our resource constraint environment if we're really looking at equitable care. There needs to be that bringing private sector on board. And that was how I delved into that. And looking at that, I was asked, it was such of more like a call to action for me to really bring that into supply chain, because in supply chain management around medicine access, how do you bring the private sector and government together to strengthen medicine access through supply chain. So, and it was really my understanding of the policy space in government, my understanding of the business environment, and the critical need to address those supply chain gaps, whether it's in infrastructure, which is very key, whether it's in distribution or logistics. All that really is really why that journey of pharmacy to public health and now supply chain, that's the intersect. So yes, that's my journey.
And what a fantastic journey it's been. And, as the CEO of ARC-ESM, a lot hangs on your shoulders, and yet recently you had a personal loss, and yet you still continue to lead with clarity and purpose. How do you stay grounded and resilient in difficult times?
Hmm, very, very difficult. It's, I mean, last year I lost my younger brother. He died. He was killed in Jordan.
Oh,
And
I'm
while
so sorry.
Yes, and he was my public health kind of like ally, and then it was really difficult. But I would say three key things that really helped through that. One is my faith. I am happy to say that I have a by the grace of God, I have a good relationship with Jesus Christ. I'm happy to say that. That really helped me to really think beyond myself, to look at what the Bible says, that we will all go through difficult times, but we must continue to live for the good of humanity. And my family, I also come from, we all are, I would say, people of faith. So we rallied around each other and kind of became our own therapists. We faced the same thing and we came together. And I mean, including my husband, it was really, I had support. And then, of course, is, I would say, finally, really is the need to really look beyond yourself, to know that we all come here with responsibilities on our shoulders. If everybody were to look at their personal pains, and people all have personal pains, and then let that affect the areas of responsibility, then there will be no need for the world we live in. So being mindful of the responsibility of running an organization, commitment made to government, commitment made to people to stay strong and grounded, regardless of personal, challenges, also helped. Yes, so that is it.
Thank you for sharing that with us. And what would you say is one of the biggest challenges you faced leading the African Resource Centre, and what did you learn from it?
Well, one of the biggest challenges I have faced is really proving the value of locally led
Mm.
and woman led. And I will say this: when we started this, the ARC was and we call it the ARC, was initially a project put in place by the Gates Foundation, and they put it up, three regions: South Africa, then Senegal, and Nigeria. And in the other regions, and most of the leadership were mostly men, and also not everybody was really from Africa in its quotes. So basically, it was a diverse team. So when we wanted to set up the ARC in Nigeria as an organization, we faced a lot of challenges. I faced a lot of challenges being the one spearheading that in Nigeria, because of, you look at most traditionally, organizations that are outcome based or similar to what we're trying to achieve. They rely heavily on external, often donor driven structures and influence. And there's often that, you could say, implicit bias that leadership for regional initiatives in Africa must come from outside the continent to be credible or successful. And you wouldn't blame, I like to be business minded about this, about trend. One would look at what has worked in the past. And I think that mindset was really, really subtly, I would say, the expectation from many partners that yes, you can continue being the operational head, but in terms of the strategic leadership, the fund manager, it did look like it was a big major challenge. But I think when I took on that role, one of the things I had to do was really to show that yes, not just that I have the technical competence, but also I had the ability to continuously, I like to say continuously because it's about demonstrating legitimacy. So just continuously demonstrating legitimacy, build trust, and kind of begin to shift long-standing narratives. And I felt I was standing for everyone. I said,
Mm.
if I make this succeed, then we will change the narrative. So for me, it was a challenge, but it was something I felt I was, you could say, fighting for Africa. So yeah, today that we are 5 years. We became 5 years, June 20th. After that fight, and we continue to work with donors. So this shows that yes, and today people are saying, well, you did it. We can do it. So yes, it was a challenge, but we tested the ground. But I want to continue to say it's good to show legitimacy. It's very important. Continuously do that. So don't drop the ball. Thank you.
And well done, congratulations.
Thank
And
you.
what would be your advice to future female African leaders, aspiring leaders?
I think must be sure that I always say it is good sometimes, during this era of diversity, a lot of organizations do put in place, or rather it's good to see a female leader, but you must go beyond the seat that you have given to demonstrate that you really have the competency to be there. So I always say to young women that are aspiring to become CEOs, I say it's a very challenging space. It's something that you need to make sure that you have the technical ability to hold that position, and it's not just because they are doing a diversity drive. So I say make sure you have what it takes. Build yourself technically. Second is, if you my advice always is make sure you have family support, because particularly from my area, where there's a cultural expectation if you're a woman. So make sure it's something you discuss extensively. If you're married, explain the challenges. I'm currently in the UK, been out of home for 2 weeks. You can imagine that kind. So I always say to women, particularly in Africa, we have a different culture. Don't even kid yourself. Culture is important. And do not take on other cultures just because it looks, they tried, how do I put it? That are different. The culture
Mm.
is important, and there's a reason why it is like that. So I say, please make sure that you have family support, you are very transparent about the role you're taking, and don't drop the ball on the two sides. Very important that you make your home. I always say, if you are a successful CEO but not a successful homemaker, it is not worth it. My daughter says I'm not traditional, I'm too traditional, but I say, well, you are evident that I did something right. So
Mm.
yes, be mindful of culture. It is important, and do not just be successful in your work and lose ground at home. Very important.
Very wise words. And ARC focuses heavily on supply chain transformation. What are some of the most promising tools or practices helping to improve visibility, continuity, or delivery on the ground?
Yeah. I think one of the things we have done is that we've come to understand that while technology and innovation are important, the most promising tools are, for supply chain transformation are often rooted in policy. It is that fundamental. And in strategy and in systems alignment, if you don't have that, no matter the technology and innovation, it won't really scale. So one of the most critical enablers we've seen is the establishment of clear national policies that define roles, set standards, and prioritizes supply chain performance as a core part of health system strengthening. Very key. When you have that, it becomes you will say it's easy for the government to fund, because if you have a technology or innovation that you're not going to get funding backing, it will be how do I put it, more like a project approach. It will have a timeline that once you don't have that fund, it dies. It's not
Mm.
sustainable. So I always say that it's important to really prioritize policy. It's important to really prioritize the strategies behind the policy, particularly a dedicated workforce. Those are the innovations. When you have that structure, when you have that, then you can layer on that the technology.
Mm.
So um, technologies are not so difficult to adopt. It's just that many are quick to bring in technology as the solution without understanding what is the governance mechanisms for that. And I always say in Africa, one of the things we've seen is that we're building maybe where developed nations were maybe 1930s or 1940s. You can imagine coming to the UK in 1940s to bring a fancy tool.
Mm.
It has taken UK, it has taken you time to
Mm.
build systems. Now technologies is really, it's easy to integrate.
Mm.
We are building, so it's going to be a marathon, not a sprint. We need to put in place some of these mechanisms that will ensure whatever technology the people that are running the operations can use it. It will be funded by government because the policies are there, the right policy frameworks, the right skilled workforce, financed through committed public resources. Those are the innovations and the things we need now. Then we
Mm.
can scale other things. Yes.
That's really interesting. And I guess global partnerships are quite important to that as well. And I'd
Mm,
like to talk about your views on global partnerships because you've worked with institutions like MIT and Arizona State.
mm.
In your opinion, what role do global partnerships play in strengthening local systems?
I think the most important thing is while we are on our journey of growth is that we don't need to, we can scale, we can leapfrog. We don't need to take the time that other nations took. If it took UK 20 years to put in place systems, they've done a lot of research around
Mm.
that. They are cutting edge research, there are technical expertise, and there are innovation models that are within the global systems. That's why we work with MIT and we work with Arizona State. What did you learn on your journey? And we leapfrog that. So for us is this partnership reinforce like mutual learning and
Mhm.
elevate the credibility of locally led initiatives, because then we learn, we collaborate, they understand where we are, we know what they've tested and tried, and then we can scale. So we're moving at a great speed now in Nigeria. It's not taking us time to develop systems because of these partnerships, because we don't need to learn in isolation. There are so many models, there are so many things and technical expertise from all over the world. So when we partner, we do a lot of research work with them, master's thesis work. We want to develop a system. We bring them in to look at our system. And with that, we are really able to co-create solutions that are globally informed and locally relevant. So that's really the key.
Mm. And what can Nigeria do to attract strong global pharmaceutical and technology partnerships that align with your public health needs?
I think one of the things I always say I work a lot with the government, key stakeholders, is please create a clear, stable policy environment. Stable. That the political transitions don't affect. One of the challenges we have is when there's a current political government, we have new policies, and then the new one comes, you keep this one. So I always, the things I feel that will attract strong global pharmaceutical partnerships is that we have a stable policy environment that really prioritizes transparency, very key. Regulatory alignment. So basically being able to understand, which is why I like the global policy network partnership we're going into, is let's look at what is a regulatory system and where are the alignment points, because then we begin to speak the same language. And of course, it's important that regardless, we do not affect the local manufacturing. That's the biggest challenge. We have many global pharmaceutical partnerships. Many want, they have the wherewithal to dominate the market. So we have to create a clear line to say, well, leave this line of products for the local manufacturers. We need that to grow. Then you bring in this strength. Do not come in to take over. Then you hinder the local manufacturing. So yes, stable policy environment, very key. And keep prioritizing transparency, regulatory alignment, and do not hinder local manufacturing, then we're good.
That's fantastic. And where do you see the biggest opportunity for innovation in Nigeria's pharmaceutical sector in the next 5 years?
That's a good question. So I think the biggest opportunity, I mean, if we look at, and again, I'm not I keep saying, my children say, "Mommy, you're a bit boring. You're so traditional." But I think, in my own view, is private partnerships, not necessarily bringing in new infrastructure. I think is how do we bridge the regional market? We have our strength, but there are strengths outside us. We mustn't expand if there are partners that can bridge the gap. So for me, the greatest opportunity is leveraging the capabilities of other organizations, whether global or regional, and that is across the value chain. It could be for manufacturing, access to medicine. It could be for logistics. It could be for tech. It could be for financing. There are other competencies that want access to our market. We have the population. We have, and we're increasing. I mean, so there are markets here in Nigeria. So looking at what are the solutions out there and form partnerships. So beyond what people know about public-private, I really think we need to begin to look at private-private partnerships, and that for me will be the major opportunity for innovation in Nigeria's pharmaceutical sector.
And you're a strong advocate for integrating pharmacists into the supply chain leadership and also the pharmaceutical sector overall. Can you unpack why that matters so much now?
Well, I'm an advocate. Sometimes my advocacy puts me in trouble. But yeah, I think integrating pharmacists into supply chain leadership is more critical now, than ever before because of the current socioeconomic environment, where we're looking at achieving universal health coverage, healthcare for all, and it has become for us a national priority. So for me, and this is a policy directive that we know that currently pharmacists are not so aware or are not so involved. So for me, integrating that into supply chain, bringing pharmacists into the supply chain leadership, key. So that means that pharmacists need to understand how they play a role. Pharmacists not only, this is important because universal health coverage is linked to access, equitable access to medicine. very key. And we are the medicines gatekeeper. So we understand the medicines and the patient care. When we are equipped with supply chain management competencies, then it becomes, more efficient. So because like things around data-driven planning, logistics coordination, strategic procurement, they become essential decision making, skill sets. And we need appropriate decision makers in ensuring consistent access to affordable quality medicine. So as Nigeria works towards universal health coverage, you see that we need leaders who can align clinical needs with system efficiency. We need that. And pharmacists are uniquely positioned to drive that transformation from both ends. So that's really my thought. That's why I advocate.
And it's great that you are advocating for this. It's a very important area. So,
Mm.
what would you say are the reforms needed in pharmacy education or professional development to close the policy knowledge gap amongst pharmacists?
Well, very, I think one is we need to look at the curriculum, integrating health policy and systems thinking. I can't say it's enough because pharmacy education should embed courses on health policy. It's important. Public health systems, and we look at relevant health policies. What is the current policies? And so that means that even our universities must remain relevant in the ecosystem. One of the greatest challenges we face in Nigeria is that it's like the universities are on one side of the country, so separate from policy making. So if you are not really, and we are living in a dynamic economy now, things are moving fast. So if what you're teaching, I think I visited some schools way back when I was trying to highlight this, and they said, well, we know supply chain, we have it in our fourth year course, and I said, oh, that's great. So what informed that? They said, oh well, and this is like say 2019, and they said, well, we attended a course in 2011. I said, 20. I said, you've got to be kidding me. I said, since 2011, have you done something else? They said, no. So I said, you are using the same manual you got in 2011 to still recycle. So we need the universities to be more integrated in operations. It's so key in policy making, in operations. We need to remove that barrier. Of course, there is really need for field-based learning. Really, I think that there should be we should foster collaboration with public health policy and economics disciplines. I think traditionally now you have many pharmacies that do their internship in community pharmacy, in hospital pharmacy. They are not looking beyond their, the one line of practice. When decisions around universal health coverage covers different sectors, so we need to look at field-based learning that are relevant. So that has to change. I also think continuing education focused on policy engagement. Postgraduate and continuing education should offer targeted, modules on regulatory processes, policy formulation, and stakeholder engagement to empower pharmacists. And one of the challenges we see is that even our continuing education is still within the same university, the same group of lecturers that have limited insight into what is going on. So again, is the faculty needs to upgrade their learning to transfer that into the curriculum upgrade, and then the students need to diversify their field learning experiences to see what is going on in the marketplace. Yes.
And what can Nigeria learn from international models like the UK or others to optimize pharmacist-led service delivery?
I think from the UK particularly, we can look at things like expanding the scope of pharmacist-led services. We can look at such as areas like medication reviews, chronic disease management, and prescribing. I think the UK has done more where they are allowing pharmacists to go into prescribing, which is still not something we're practicing in Nigeria. And that within primary healthcare. Currently, even most of our pharmacists don't have strong primary healthcare foundation. Most prefer to practice in tertiary and secondary, which is where the gap is when you're looking at universal health coverage, because many don't see value in practicing in primary healthcare. Ghana really is really looking at value of integrating pharmacists into community health systems so that we can learn. If and that's again the primary healthcare, improving access and continuity of care. Pharmacists are not playing that role now because we're not focusing on primary healthcare. What then happens is other fields are entering pharmacy practice. So, and pharmacists are complaining that nurses are taking their jobs, nurses are going into prescribing, or pharmacy technicians. But when you offer a pharmacist opportunity in primary, they don't see themselves there. So, I think we need to learn how to integrate our pharmacy practice into primary healthcare, like UK expanding our role, and then of course, like Ghana, integrating it into community-led practices. Yes.
And what role can community pharmacists play in improving outcomes for women and children, especially in rural or underserved areas?
Well, I think if you look at community pharmacists, they are really the frontline providers of care. That so if you're looking at improving outcomes for women and children by offering accessible or trusted healthcare services, then you're talking about community pharmacy practice. But like I said, right now in Nigeria, we hardly find a pharmacist at that level. At when you talk about where the outcomes are weakest, which is in the rural communities. So you see community pharmacists in the urban, and the health indices at the urban centers are not that bad. So where there is a need for improving outcomes, which is really at rural underserved, you don't see our community pharmacists. So within a universal health coverage framework, we need to begin to see ourselves playing that role. Again, this is the fault in I would say the gap in our education system that is not really highlighting to upcoming pharmacists the role of pharmacists in universal healthcare. So when they don't see it, they really think it's okay if I'm in the urban center, it's okay if I'm focusing in secondary because I'm providing patient care. And I choose to do this here. But then without having that mindset of equitable access to care, the pharmacists can't bridge the gap in care continuity, and they can't reduce the barrier to essential medicines and health advice. So those are things that I think is the totality of the gap. We need to see how relevant we are in the rural community as it speaks to the policy, the value creation. If not, nobody will go to rural communities to provide community healthcare services.
And Nigeria is scaling up local pharmaceutical manufacturing, but there are challenges in terms of cost, viability, regulatory. How do we balance scaling up with sustainability?
Well, I think the most important thing is you need to balance it in terms of we need to have like a multi-pronged approach. I always say Nigeria is complicated. Things are not always as simple as when you identify the gaps and all that. So you need to again implement clear regulatory standards, but encourage clear regulatory standards that encourage quality without stifling innovation. That's it. So one of the challenges we have is that as a country, we are not really offering a lot of incentives to reduce production costs. So But recently, I think this year the government is beginning to change their approach towards that. Before now, the manufacturers were pretty much really on their own. Just to give context, in Nigeria, I think way back in, I don't know which year, the policy enables or importation was much more affordable than manufacturing.
Mm.
Yes, because of a policy, because I think at that point we didn't have a lot of manufacturers. So the government, in trying to make sure we had access, kind of basically put in place a policy that promotes importation.
Mm.
So in a lot of cases, is more affordable to import than to manufacture. So if you look at that, is we need to really scale up local manufacturing by removing such barriers. you
Mm.
know yes. And then, because if you can imagine, that's part of the reason why we've really had a challenge in the implementing the regulatory, because it is more affordable to import. So it created room for everyone to go into importation if you can just get a pharmacist that work with you. So that kind of really balancing, looking at what has enabled the infiltration of
Mm.
poor quality medicines from the policy work stream, and see how you can really twist or change that at that level. They are looking at that, so to see if we can change that, then that creates room for more manufacturing and reduces that influx of poor quality. So yes, it's really looking at those approaches.
And if you could redesign Africa's health supply chain from scratch, what are the first three things you change or prioritize?
Woo. I think one is, again, I've said it before, governance models, really establish robust public-private partnership frameworks. Really very important that we look at every policy that strengthens public-private partnerships. So I was looking at the resource constraint. I will really strengthen that, and then definitely sustainable financing as the second one. I always say, if it's not going to be funded by government, it shouldn't start. So for me, is the solutions must be backed by predictable government funding. Predictable, not just one-off, to ensure long-term resilience and accountability. So I would say, let the model be such that we leverage other capabilities. Don't build from scratch. Look at what we have. Look at partners that want to advance with us. Then government must put in place a sustainable financing. Then the third thing I will really focus on is local capacity,
Mm.
locally led, and then emphasize building leadership towards that. So I think prioritizing building skilled, empowered local teams is critical for us to sustain whatever we have. So that it's not when the solution is not funded, then the technical ability is not in place. So yes, these three things for me key.
That's fantastic. So now let's talk about your relationship with Global Policy Network. So ARC is due to become a partner of Global Policy Network, with the two organizations coming together to tackle some of the most salient and timely questions in medicines access. As a partner, what excites you about GPN's mission and vision, and what got you involved?
I mean, thank you very much. We're excited about this partnership. And I think for us, GPN, your commitment to evidence driven policy advocacy that really addresses systemic barriers to medicine access is something that aligns perfectly with ARC's mission. So for us, is the ability to co-create. When we come together to look at the salient issues, I think that the ability for us to co-create sustainable solutions tailored to Nigeria's unique challenges for me is key. So for me, this partnership offers that incredible opportunity, if I may say so, to amplify impact through shared experiences. So our the fact that we speak the policy reform language, and also that we are all ultimately focused on improving health outcomes for communities. I think that is just a shared value that makes it a partnership I personally am excited about.
Fantastic. I'm excited too. And now we're going to have a quick fire round. So tell me about someone, whether it's a person you know or a public figure that has inspired you.
Now to that. A personal figure that has inspired me. And so don't laugh, but I talk about I think it's linked to the movie I've watched and also I've read, Joseph in the Bible. So I look at it because it's kind of like opened my eyes to the first supply chain transformation actor. Something that we don't look at. We know that story and the premise of he's being sold as a slave and all that story. But if you read that story and if you watch the movie, you will see um, the system that was put in place to address world food hunger. And that actually, the fact that he could come up with solutions that resonate with what we're doing today, that for me is inspirational. If you look at what he did, is he looked at he looked at it and he could provide a forecast. He said to the Pharaoh in Egypt, he said, look, this is going to happen the next 7 years. This is how much commodity we're going to get. And after that, this is how this commodity we store, we address this 7 years gap. So for us to look at, so he could forecast, and that's what we really look at in medicine access. He could forecast and he could say, do you know what? Based on what we see, we're going to have this ton of grains. We need to create stores. So he understood the infrastructure that was required. Not just that, he said we need to create stores in different regions, the different regions in Israel, in Egypt. And he said when you create those stores, you need to assign commissioners. I mean, that's fantastic. He said you need a commissioner per district. And when we talk about Egypt and advanced, you would say the civilization, we in our context, there's so much civilization in those ancient Africa regions that it looks as if we are adopting civilization from the Western world. I think it's the other way around, because if he could look at those systems, appoint commissioners that will report, he said, these commissioners should report only to you to make sure you get the appropriate information. So what are you looking at? Data-driven systems. He said they will keep the stock. And in that whole story, he counted every grain that entered the store. And then these commissioners would take that information and give to Pharaoh. And he said, you be the one that will make the decision, because if you don't do this, there'll be food hunger. What else inspires like that? So I think that story, as short as it is, really I think it informs new or modern supply chain solutions. And for me, that's one of the most inspirational things. And of course, I'm supply chain at heart, so that that approach really resonates with what we are doing, the need for appropriate policies, the need for the right kind of people, local solutions, and the need for using data to make decisions. So yes.
And what gives you hope right now?
Yeah, I think I would say one of the biggest hope givers right now is the fact that all over, I would say Africa wide, we're beginning to look internally. It wasn't really because we planned to, but with the new policies from USA and aid that has been abruptly cut off, which of course is like a yanking off of a wound, which is painful. But when you have such things, what then that does is, instead of giving up, what it does is that it makes you think about what you need to do locally. So what is giving me hope now is that everyone where I am, they are looking at, so what can we do? What we're not looking at, so who can help us? Who can help us? So the moment we are more on what can we do as a continent, what do we have internally, what can we leverage, that is for me most powerful. So somebody said, don't, let's not miss this opportunity, because we may not get, if you get another donor that will come and bridge the gap, we go back to very dependent systems, and we need to build our own. I'm not saying we have all the resources, but I think if you build your own, you fund your own, then you look at co-investment partners and not aid. So they need that we design solutions that we fund, and then we look at things from an investment mindset and not aid. And even when aid comes, it is a support, not a dependency. For me, is critical now. So I do have hope.
That's amazing. And it's great to hear about that self-resilience that's building in Nigeria as well. So going back to you, so if you weren't doing this job, what would you be doing?
Well, it's hard to say, but I think, and I always say it, if I was not doing this, probably I'll be running. Okay, I've always desired to run a rehabilitation center. I'm very passionate about um, 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 dependency, alcohol, drug dependency, and it's something that touches my heart. I was really thinking of going into rehabilitation, building a home, that will get people off, dependency. So yes, probably if I wasn't doing this, and I hope I still get to do that, because it's something I'm really keen on following through at some point. So, but if I wasn't doing this, probably is that home, that rehabilitation home, that I would have focused on. So yes, yes. But for now, we're doing this transformation.
And that's beautiful. And I hope that you get to build that rehab home one day. And finally, at GPN, we love to shout out to individuals or organizations to join us on Policy Unpacked. So, if you could do a shout out to any organization or individual, public or private, that you feel should be joining us for a future episode of Policy Unpacked, what would you say that person or organization was?
So, for any organization that really wants to make impact, that really wants to understand how you want it, but you also need to know how to make impact, and then also learn from what others have done. We don't need to reinvent the wheel. I think you should come and join Global Policy Network, because they are looking at policies across the world. For them to be partnering with us in Nigeria, they are gaining insight into what we're doing. And they have worked extensively in the UK, and they are also in other African countries and even beyond Africa. So I think it will be worth your while to understand the policy workstream, the health policies that are available for medicine access. If you learn, then you can adopt or you can adapt, and then it can just leapfrog. So join this network and let's learn together.
Thank you so much, Azuka. Thank you so much for joining us today and sharing your insights, your personal stories, your growth. Is there anything you'd like to add or say to our listeners before we go?
Well, I would say look out for our partnership as ARC-ESM and GPN. Join our policy series. From our perspective, we'll give you things you don't read online because they are not there sometimes. You'll get real insight into what is happening in Nigeria, and a lot is happening in Nigeria when it comes to medicine access. So don't miss this our podcast series. Make sure you follow the GPN and ARC-ESM on social media, so that you can get insight into our plans and get how do I put it? Look out for a most exciting partnership and what we'll be sharing. I look forward to seeing you all.
Thank you so much, Azuka, and thank you to our listeners. So join us for our next episode next week. And remember, follow us on LinkedIn, Instagram, Facebook to find more content. You can give us a like, a follow, or leave a comment on Spotify, Apple Podcasts, or YouTube. Thank you so much for listening, and see you next week. Goodbye.